Hey everyone, it's Dr. Eric. I'm going to tell you what they're not telling you about menopause, the truth about statins, estradiol, and much more. So, HRT effects on lipids, meaning cholesterol molecules. There's a lot of stuff going on. As you know, my battle is against the traditional medical world that's speaking kind of nonsense, I guess. I was in that traditional world for a long time as a neurophysician, and I've seen the effects of different treatment modalities. And the narrative that's out there is really about getting away from nature, right? We want people, they want us inside, taking pills in front of a phone all day, not doing any physical activity, eating processed junk foods, and just being happy, being flat, boring, fat, and weak. And that's not what I want. My battle is against that. I want us to be prime. That's why my company, I created Primax. I want us to get back to nature, get back, fight the powers that be, so to speak. And I want us to get back to our roots, to get back to our primal nature of getting outside, interacting with others, eating real food, moving, lifting things, doing things, getting out in the sun, the fresh air, getting our health back and getting our vitality back. That's what it's all about. So when it comes to lipids, this has been a big thing that's been going on through the myths and pervasiveness of traditional medical culture and big pharma influence of, it's all about the cholesterol. Cholesterol's bad. You got to take this pill, this statin drug. Everybody needs to be on, should be in the water, and it'll take care of everything. That's clearly not true. Yes, it will lower your lipids, but the end result is not changing much. There's not much change in heart disease. And people are going to say, yes, of course, there's tons of studies. Yes, they have a place. In traditional medicines, I will use them. Of course, I'm not like anti-medication, of course, but they have a time and place. They should not be for everyone. It's not just about the cholesterol. They've done studies where they compare people and they've dropped lipids, they've improved, and they still have heart attacks. They still have strokes. It doesn't change much. So it's about the underlying inflammation. It's about the damage. It's about the lifestyle. It's about the other things that are affecting the body that are causing these issues. In the Journal of Menopausal Medicine, they compared estradiol and they looked at statins as well. So bottom line is, when I'm talking another myth about oral estradiol, everybody freaks out and worries that it causes cancer and strokes and all these things. It doesn't. It's very safe. It's never been shown. It has much more benefits on longevity, bone health, heart health, and much more. Transdermal estradiol had no change. Oral estradiol lowered lipids, but also lowered the dangerous Lp(a), which is hard to change. Not much can do it. Statins don't do it. Not much does. It's a genetic thing, but it can be altered with lifestyle and hormones. And it also increased the positive HDL, which has more of an impact on anything else than compared to LDL. And I do a deep dive in lipids. It's not just about HDL and LDL. I look at the oxidized LDLs, all the inflammatory markers, and so much more in my profiles. We all know that after menopause, there's an increased risk of cardiovascular disease. And men, of course, is the number one killer as well. But women, we both, men and women get it especially. Why? Because of the drop in hormones. That's one reason. Of course, there's other reasons too. But basically with HRT, bioidentical HRT, there's a massive drop in cardiovascular disease by over up to 50%. Preventing death up to 50%. Huge. You don't see that as numbers with statins. And more importantly, the HDL was more important predictor of cardiovascular disease than LDL, which we know estradiol does a fantastic job of this. Transdermal estradiol does not. The patches, the creams, they don't. Oral estradiol does. Period. The multiple studies have shown this. So the other thing is about HDL, how you raise it. Yes, you can take niacin, you can do these things, and I'm a fan of that, but just doing that doesn't really change much. So you have to do it the right way. You have to let your body do its thing. You have to get it to raise it naturally. Then you'll get a beneficial effect. They've done studies on like these other supplements just to raise HDL, and it doesn't do anything. Just like the statins. Yeah, you'll drop your LDL, but it doesn't change anything. You're still gonna have heart attacks and strokes. It doesn't change vascular disease like I did on another video. Coronary artery calcium score did not change. In fact, in some cases, it got worse. Whereas it would actually go down with estradiol. It will go down with other hormonal therapies. So the end result is not being changed with statins. And then you're getting side effects, you're wasting money, and you're increasing risk of insulin resistance and diabetes and cancers by big numbers, which I'll talk about at another time, but nobody talks about that. So for secondary prevention, you've had a talk, there are some effects and beneficial effects, but primary prevention less than 1%. So you don't need them, they're not doing much for you. So again, how you raise HDL is important. How do you do that? By reducing visceral fat. And you do that with lifestyle, diet, exercise, and of course, hormone optimization, especially estradiol, testosterone, thyroid, DHEA, and much more. You reduce the visceral fat, and then your body's going to take care of itself. It's going to raise your HDL, drop your triglycerides, and reduce inflammation, or reduce all those inflammatory markers, which are the instigating event, which then the lipids are coming in to fix and package and steal. Again, the lipids aren't the bad guys. They're trying to heal your body. So anyway, so that's the truth, and there's more of these truth bombs to come, baby. We want to get prime, get back to nature, get back to our primal health and away from all the artificial crap out there. So everybody stay strong, live prime, do something nice for someone today. Remember, live to give, pass it forward to everyone else. Everyone have a rocking day. Please like and share this post. And if anything else you want to hear about, please comment in the section below. Everyone have an awesome day, and we'll talk to you soon.